PSA test explained. PSA is probably the most anxiety-provoking blood test for men. Every week, I see patients come into the clinic extremely worried after seeing a slightly elevated PSA value on their report. Many of them believe that a high PSA automatically means prostate cancer and that surgery or biopsy is inevitable. That is not true. So let me explain in very simple terms what PSA actually is, why PSA levels rise, how do urologists interpret PSA correctly, and when further tests like MRI or biopsy are truly needed. Understanding PSA properly can prevent unnecessary fear, unnecessary biopsies, and unnecessary treatment. What exactly is PSA? So PSA stands for prostate specific antigen. It is a protein produced by prostate cells and released into the bloodstream in very small quantities. Every man with a prostate has a PSA in his blood. PSA is not a cancer marker, but rather is a marker of prostate activity. Anything that increases prostate cell activity or disrupt the prostate architecture can cause a rise in PSA. And this includes benign conditions, infection, inflammation, and in some cases, cancer. Why PSA level increase? There are several reasons why PSA can increase. The most common reason is prostate enlargement, which naturally occurs as the men age. As prostate size increase, more PSA is produced. PSA can also rise due to urinary tract infection or prostatitis, recent catheter insertion, cystoscopy, even ejaculation can give rise to PSA. Long bicycle rides or even a vigorous exercise can temporarily elevate the PSA levels. Prostate cancer is just one of the many causes and statistically not the most common one. So what is normal PSA by age and prostate size? One of the biggest misconceptions is that PSA has a single normal value. There is no universal normal PSA. A PSA of 4 may be acceptable in a 70-year-old man with a large prostate, but the same PSA of 4 in a 45-year-old man with a small prostate need closer evaluation. That is why we consider age, prostate size on ultrasound or MRI, the symptoms what he presents with, the PSA trend over time. Other parameters like PSA density and PSA velocity are often more meaningful than the absolute number. Common mistakes and overreactions. One common mistake is panicking over a single PSA value. PSA should always be repeated after treating infection or inflammation. Another mistake is rushing into biopsy without proper imaging. This can lead to unnecessary procedures, bleeding, infection, and long-term anxiety. PSA is meant to guide decision and not force decisions. When further testing is needed, we consider further evaluation if PSA continues to rise consistently or if the PSA density or velocity is concerning. In such cases, MRI of the prostate is usually the next step. MRI helps identify suspicious areas and avoid blind biopsies. Biopsy is done only when there is a clear indication and not routinely done. Take-home message. The most important message is a high PSA does not automatically mean cancer. PSA must be interpreted carefully, patiently, and intelligently. When used correctly, PSA helps detect cancer early while protecting patients from unnecessary procedures. If you understand PSA properly, you stay in control and not in fear. Thank you for watching this video. If you feel this video is helpful, kindly share it with someone who needs it. Thank you again.